Let me ask you something very personal right now. When you sit down for more than an hour, watching TV, reading, or just resting, do your legs feel heavy when you stand back up? Like they have weights attached to them? Do your feet and ankles swell up by evening? Does your skin down there feel tight, almost like a sausage? Do you sometimes wake up in the middle of the night with a cramp so bad in your calf it makes you jump out of bed and gasp? If any of this sounds familiar, I need you to stay with me right now. Because what I'm about to share with you in the next few minutes could be the most important thing you hear this entire year. I'm not exaggerating when I say that, because what most people think is just normal aging or I just need to move around more is actually your body sending you a very serious warning signal, a warning that millions of Americans over 70 are ignoring every single day, and many of them are paying a very heavy price for it. I'm talking about poor leg circulation. And today I'm going to tell you about the one exercise, one specific movement, that a leading vascular surgeon recommends above everything else for people over 70 to help fix this problem. It's free. You can do it sitting in your chair. You don't need a gym. You don't need any equipment. And the science behind it is rock solid. But first, I need to make sure you understand why this matters so much. Because once you understand what's really happening inside your legs right now, you will never ignore this again. Stay right here. This one is for you. Part 1. What is really happening inside your legs? After 70. Think about your legs for a moment. You've been using them your whole life. Walking, working, raising your family, going to church on Sundays, dancing at your grandkids' weddings. Your legs have carried you through everything. But here's the truth, no one tells you clearly enough. After the age of 70, something very real and very serious starts happening inside the blood vessels of your legs. It doesn't hurt at first. You can't see it, but it's there. And if you ignore it long enough, it can take away your ability to walk. It can lead to wounds that don't heal. And in the most serious cases, doctors can be forced to amputate a leg. I know that's hard to hear, but I'd rather tell you the truth now, while you can do something about it, than have you find out too late. Here's what's really going on. Your heart pumps blood down to your legs easily. Gravity helps. That part is fine. But the real challenge is getting that blood back up from your feet and legs against gravity, all the way back to your heart. How does your body do that? It uses something called the calf muscle pump. Your calf is not just a muscle. It is literally your second heart. Every time you walk, every time you move your foot up and down, your calf muscle squeezes the veins inside your leg like a hand squeezing a tube of toothpaste and pushes the blood back up toward your heart. This is why soldiers standing still at attention sometimes faint. This is why people on long airplane flights get dangerous blood clots in their legs. When you stop moving and when your calf muscle stops pumping, the blood begins to pool in your lower legs. It gets sluggish. It gets stuck. Now here's the problem for people over 70. As we get older, our arteries, the pipes that carry blood down to our legs, start to get narrower. A condition called peripheral artery disease, or PAD, affects somewhere between 8 and 12 million Americans. And the shocking part? According to the American Heart Association, many people who have it don't even know, because it often starts with no pain at all. The plaque, the same sticky, fatty buildup that causes heart attacks, quietly builds up inside the arteries of your legs, year after year, until one day the pipe is so narrow that when your muscles ask for more blood, the supply just isn't there, and then you start to feel it. That cramping when you walk upstairs, the heaviness in your legs after an hour on your feet, the cold toes even when it's warm inside the house, the swollen ankles at the end of the day, the sores on your feet or shins that seem to take forever to heal. According to research published at Northwestern University, people with even mild circulation problems in their legs are 3 times more likely to lose the ability to walk a quarter mile or climb a single flight of stairs without help, compared to people with healthy leg circulation, 3 times more likely. Think about what that means for your independence, for your quality of life, for your ability to be there for your family. And here's something else your doctor may not have told you. Poor leg circulation is not just a leg problem. It is a signal that your entire cardiovascular system may be under stress. The same plaque buildup in your leg arteries is almost certainly happening in the arteries near your heart and brain as well. This is why people with PAD, even with no symptoms, have a significantly higher risk of heart attack and stroke. Your legs are not just your legs. They are a window into your heart. Now, I know this may feel frightening, but here's what I want you to hold on to right now. You are not helpless, not even close, because the human body, even at 70, even at 80, has a remarkable ability to adapt and improve when you give it the right signal. And that's exactly what the exercise I'm about to show you does. Stay with me, because what's coming next, in part 2, is the real reason you're here today. And I promise it's going to surprise you. Part 2. the one exercise that changes everything. I want to tell you about a man named Robert. Robert is 74 years old. He lives in Tennessee. About 2 years ago, his doctor told him his leg circulation was poor. His ankles were always swollen. He got cramps at night so bad his wife would hear him crying out. He'd stopped walking to his mailbox because the ache in his calves started almost immediately. His doctor gave him some general advice. Exercise more, eat better, come back in 3 months. Robert tried walking more, but it hurt so much he would stop after a minute or two. He felt defeated. He thought this was just what getting old felt like. He started spending more time in his recliner, and sitting more made his circulation worse, and worse circulation made him want to sit more. A terrible cycle. Then his vascular surgeon, a doctor who specializes in blood vessel problems, told him something that changed his life. She said, "Robert, I don't need you to walk a mile. I just need you to do this one movement every hour while you're sitting right there in that chair. That movement is called the ankle pump, and I need you to understand this is not a made-up home remedy. This is not something someone posted on Facebook. This is a movement recommended by vascular surgeons, physical therapists, and cardiologists across the United States, backed by decades of medical research. A major review published in the Journal of Orthopedic Surgery and Research, looking at multiple controlled clinical trials, found that ankle pump exercises significantly increased blood flow velocity in the leg veins and reduced dangerous blood pooling. Another study found that this simple movement, done correctly, can increase the speed of blood returning from your legs to your heart by a dramatic amount. Immediately. Right away. While you're doing it. Here is why it works. Remember the calf muscle pump I told you about? Your second heart? The ankle pump is the most direct, most efficient way to activate that pump without putting stress on your joints, without needing to walk, without needing to stand up. When you pump your ankle, pointing your toes down, then pulling them up toward your shin, you're squeezing and releasing the deep veins of your calf. Every single pump pushes a small wave of blood upward through your venous system toward your heart. It is like manually squeezing that toothpaste tube over and over. Medical professionals actually use this technique for patients after surgery, patients who cannot get out of bed, specifically to prevent dangerous blood clots from forming in the legs. Hospitals teach it because it works. It is that well established. And here is what makes it perfect for people over 70. You do not need to stand up. You can do it in your recliner. You can do it while you watch the evening news. You can do it at the breakfast table. You can do it right now as you watch this video. Let me walk you through it. Exactly. Sit in a comfortable chair with your feet flat on the floor. Now, keeping your heels on the floor, lift the fronts of your feet up toward your shins as far as they'll comfortably go, like you're trying to point your toes at the ceiling. Hold it for just 1 second. Then lower your feet back down and now push your toes down toward the floor, like you're pressing a gas pedal, as far as comfortable. Hold 1 second, then back up, then down. That is one complete ankle pump. It should feel gentle. It should never hurt. You're not straining. You're not forcing anything. You're simply squeezing and releasing that calf pump. Do this 20 to 30 times in a row. Then rest for a minute. Then do another set. The goal, and this is the number that research backs up, is to do this once every hour that you are sitting. Once every hour. That's it. That is the whole prescription. Now, I can hear some of you thinking, that sounds too simple. Can something this simple really make a real difference? And the answer, based on the medical evidence, is yes. Absolutely yes. But there is something important I need to add. Because the ankle pump is powerful, but to get the best results, you need to understand what else is making your circulation worse, and what you can do about it starting today. That's coming up right now. Do not skip what I'm about to tell you next, because this next part is where most people make the biggest mistakes, and where you are going to be different. Part 3, what else you must know, what to stop doing in your daily plan. Here's the part most YouTube videos skip. They give you the exercise, they say good luck, you close the video and nothing changes in 3 weeks because they didn't tell you the full picture. I'm going to give you the full picture because the ankle pump is your number one weapon. But there are things you may be doing every day, right now, that are working against your circulation so hard that no exercise can fully overcome them. You need to know what those things are. The first thing that destroys leg circulation after 70 is long, unbroken sitting. Not sitting itself, but sitting for more than 45 minutes to an hour without any movement at all. When you sit completely still, your calf muscle goes silent. The pump stops. Blood pools in the lowest part of your legs. Veins stretch. Pressure builds. Over months and years of this, the vein walls weaken and circulation gets progressively worse. This is why the ankle pump must be done during sitting, not just once a day as a formal exercise, but as a habit every single hour. Set an alarm on your phone if you need to. Every time it goes off, do 25 ankle pumps. It takes less than 90 seconds, and you're giving your circulation a vital boost that it desperately needs. The second thing that makes this worse is dehydration. A A lot of people over 70 simply don't drink enough water, and this is devastating for circulation. Here's why. Your blood is roughly 55% water. When you're dehydrated, your blood gets thicker. Thicker blood moves slower. Slower blood pools more. Clots form more easily. And the pressure on already narrowed arteries goes up. Many older adults have reduced their fluid intake on purpose because they don't want to make extra trips to the bathroom, especially at night. I understand, but the trade-off is not worth it. Mild, consistent dehydration is silently making your circulation worse every single day. The goal, unless your doctor has told you otherwise due to a kidney or heart condition, is to aim for 6 to 8 glasses of water spread throughout the day. Not all at once. Sip steadily. And if plain water feels boring, a slice of lemon or cucumber in a glass makes a real difference. The third thing that destroys circulation is long periods of legs down. Here's something that surprises most people. When you're resting, whether you're in your recliner or lying on the couch, where are your legs? Most people let them hang down or sit with their feet flat on the floor. What this means is gravity is constantly pulling blood away from your heart, down into your feet and legs, and your circulation is working against it. For rest periods longer than 30 minutes, elevating your legs slightly, even just 6 to 8 inches, makes a meaningful difference. You don't need a special device. A folded pillow under your calves works perfectly. Even a footstool that lifts your feet just a few inches helps significantly. This is basic, practical, and it works. The fourth thing, and this one is critically important for our American seniors, is smoking. If you still smoke, please listen to me right now. I'm not judging you. But I need you to know this clearly. Smoking is the single most powerful destroyer of leg circulation there is. The chemicals in cigarette smoke directly damage the inner lining of your artery walls. They accelerate the same plaque buildup I described earlier. Studies show that people who smoke are at dramatically higher risk for severe PED, including the kind that leads to amputation. No exercise, no food, no supplement in the world can undo what smoking does to your blood vessels. If you are doing ankle pumps every hour but still smoking, you are running on a treadmill with a parachute behind you. Please talk to your doctor about quitting. There are medications now that work remarkably well with very few side effects. Now let's talk about what you can add, not just what to stop. Foods. I know you've heard this before, but let me make it simple and specific. The foods that directly support healthy circulation are the ones that reduce inflammation in your artery walls and help thin your blood naturally, within a healthy range. Dark leafy greens like spinach and kale contain nitrates that help relax and widen blood vessels. Beets do the same thing. Beet juice in particular has been studied specifically for its circulation benefits. Berries, blueberries, strawberries, blackberries are packed with compounds that protect the inner lining of your blood vessels. Fatty fish, like salmon and mackerel, eaten twice a week, provide omega-3 fatty acids that reduce the stickiness of platelets in the blood. On the other side, the foods that directly hurt your circulation are processed foods high in sodium, which causes fluid retention and puffiness in the legs, and foods with trans fats and heavily refined sugars, which accelerate that artery-clogging plaque buildup. You don't need to be perfect, but making these shifts consistently, day after day, stacks on top of your ankle pump practice and compounds over time. Let me also say this clearly because I care about your safety. The ankle pump exercise is safe for the vast majority of seniors. It is gentle. It is low impact. It is used in hospitals on recovering patients. However, if you have been told by a doctor that you have deep vein thrombosis right now, an active blood clot in your leg, do not do this exercise without first talking to your physician. Active clots require medical management first. Similarly, if you have severe swelling, open wounds on your legs, or any sudden change in the color, temperature, or sensation of your legs, please see your doctor before starting any exercise program. These could be signs that need urgent attention. For everyone else, this is something you can and should start today. Here is your simple daily plan. I want you to write this down or screenshot this moment right now. Every single hour that you are sitting, do 25 ankle pumps. Point up, point down, 25 times. Set an alarm if you need to. When you rest for longer periods, elevate your legs with a pillow. Drink water consistently throughout the day. Walk a little, even just to your mailbox and back, if you are able, even if you have to go slowly and stop when it gets uncomfortable.